The Occupational English Test, or OET, is a language proficiency test tailored for healthcare professionals. The listening subtest is divided into 3 parts: Part A, Part B, and Part C. In listening Part A, you will engage with a consultation scenario by listening to 2 audio recordings of consultations between a healthcare professional and a patient. This section aims to assess your ability to identify specific information and details from the conversation. Part A lasts approximately 15 minutes and consists of 2 recorded consultations, each typically around 5 minutes long. After each consultation, you will be provided with a series of notes related to the conversation. Your task is to complete these notes using the information you hear in the recordings. The notes are structured with headings and subheadings to reflect the logical flow of the consultation. For example, you might hear a conversation between a doctor and a patient discussing symptoms, medical history, and treatment plans. Your task could involve filling in missing information such as the patient's symptoms, medications, and any suggested follow-up actions. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now look at the notes for Extract 1. Extract 1. Questions 1 to 12. You hear a dentist talking to a patient called Miss Anderson. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Miss Anderson. I'm looking at your notes and I see that you've been having some problems with your teeth recently. Could you tell me a little about the problems you've been experiencing?
Well, to start, I've been having this persistent pain in my lower jaw, especially when I'm eating. And then there's this constant sensitivity. Whenever I have anything hot or cold, it's really uncomfortable. But the worst thing is this one tooth at the back. It feels loose and I'm worried it might fall out.
Okay, anything else?
Yeah. I've noticed my gums have been bleeding a lot when I brush my teeth. They also seem to be receding, like my teeth look longer than they used to. And there's this bad taste in my mouth all the time, which is really unpleasant.
I see. And tell me a little about your daily routine. Do you have any habits that might be affecting your dental health?
Well, I guess I haven't been as diligent with my brushing and flossing as I should be. I tend to skip it when I'm tired, which is often because I've been working long hours as a graphic designer. And, I do smoke, though I know I should quit.
Smoking can definitely contribute to gum problems and tooth issues. And what about your diet? Do you consume a lot of sugary foods or drinks?
I do have a bit of a sweet tooth. I love my soda and chocolate. I try to balance it out with healthy meals, but I know I indulge too much.
All right. It sounds like a combination of factors could be contributing to your dental problems. Have you had any dental treatments or issues in the past?
I've had a few fillings here and there, but nothing major. The last time I saw a dentist was probably about a year ago for a regular checkup.
Given your symptoms, it sounds like you might have some gum disease, possibly periodontitis, which could explain the loose tooth and receding gums. The sensitivity could be due to enamel erosion or cavities. We'll need to do a thorough examination to get a clear picture.
That sounds serious. What can be done about it?
We'll start with a deep cleaning to remove any plaque and tartar buildup, which is crucial for treating gum disease. I might also recommend scaling and root planing if the gum disease is advanced. For the sensitivity, we can apply fluoride treatments to strengthen the enamel. If there are any cavities or damaged teeth, we'll address those as well.
Okay, I understand. And what about the loose tooth?
If the tooth is salvageable, we can try to stabilise it. This might involve a splint to keep it in place while the gums heal. In more severe cases, we might need to consider extraction and a replacement option like a bridge or an implant.
I see. I guess I need to take better care of my teeth.
Yes, maintaining good oral hygiene is crucial. Regular brushing, flossing, and dental checkups can prevent many of these issues. Quitting smoking and reducing sugary foods will also make a big difference.
I'll definitely try to make those changes. Thank you for the advice and for explaining everything so clearly.
You're welcome. Let's get started with the examination, and we'll create a treatment plan tailored to your needs.
Extract 2, questions 13 to 24. You hear a GP talking to a patient called Mr. Santos. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Mr. Santos. I see from your records that you've been experiencing some discomfort recently. Can you describe what you've been feeling?
Good morning, doctor. Yes, I've been having this annoying pain in my upper stomach. It's a burning feeling, especially after I eat. I also feel nauseous quite often and sometimes even throw up. The worst part is the constant bloating and that I always feel full, even if I haven't eaten much.
That sounds quite uncomfortable. Any other symptoms?
Yes, I've been burping a lot more than usual, and there's this bitter taste in my mouth that I can't seem to get rid of. I've also lost a bit of weight, around 5 kilos in the last few months. It's not intentional. I just don't have much of an appetite because of the discomfort.
I understand. Can you tell me a bit about your daily life? What do you do for work?
I'm a high school math teacher. I've been doing it for about 15 years. It's a stressful job, but I love it. Lately, though, the pain and discomfort have been affecting my concentration, and it's been tough to keep up with everything.
That sounds challenging. How are you managing stress?
I try to manage it, but it's been harder with these health issues. I'm not sleeping well because I wake up at night due to the pain, and that just adds to the stress.
That must be difficult. Have you had any previous issues with your stomach or digestion?
Not really. I've had the occasional bout of heartburn, but nothing this severe. This is the first time I've had such persistent problems.
I see. Is there any family history of digestive issues or similar symptoms?
Not that I know of. My parents have had their own health issues, but nothing related to the stomach or digestion as far as I'm aware.
Understood. Have you changed your diet recently?
I've been trying to avoid spicy foods and cut down on coffee because I read they can aggravate the symptoms, but it hasn't made a huge difference. I'm not sure what else to try.
Based on what you've described, it sounds like you might have gastritis. To confirm this, I'd like to schedule an endoscopy. This will allow us to examine the lining of your stomach and identify any inflammation or other issues.
An endoscopy? Is it painful?
The procedure is usually done under sedation, so you shouldn't feel any discomfort. It's quick and will give us a clear view of your stomach. Depending on what we find, we might also test for H. pylori, a bacteria that can cause gastritis.
All right, if it helps figure out what's wrong, I'll do it.
In the meantime, I'll prescribe you proton pump inhibitors to reduce stomach acid and help with the pain. We'll also talk about some dietary changes that might help alleviate your symptoms.
That sounds good. I'm willing to try anything at this point.
Excellent. Let's get the endoscopy scheduled and start you on the medication. Avoid foods and drinks that seem to make your symptoms worse, and we'll follow up after the procedure.
Thank you, doctor. I appreciate it.
You're welcome, Mr. Santos. We'll work together to get you feeling better.
That is the end of Part A.